Top 25 Residential Care Worker Interview Questions and Answers. Working in residential care isn't just a job, it's a calling that takes compassion, patience, and skill. Whether you're supporting older adults, individuals with disabilities, or those needing long-term assistance, interviewers look for empathy as much as expertise. In this video, we'll cover the top 25 residential care worker interview questions and answers to help you stand out. Listen carefully, take notes, and by the end, you'll know exactly how to express your passion, professionalism, and readiness for this rewarding role. 1. Why did you choose to become a residential care worker? Interviewers want to see genuine motivation. You might say you're passionate about improving people's quality of life and find fulfillment in helping others achieve independence and dignity. A strong answer connects your values to the job. I chose this career because I genuinely enjoy helping others live with comfort and respect. I've always had compassion for vulnerable people, and working in residential care allows me to make a direct difference in their daily lives. I love building meaningful relationships with residents, listening to their stories, and ensuring they feel valued. Seeing someone smile or regain confidence, even in small ways, gives me purpose. This profession lets me combine empathy with responsibility, which is exactly what I'm looking for. 2. What do you think are the key responsibilities of a residential care worker? Employers want to assess your understanding of the role. Focus on safety, dignity, and individualized support. A residential care worker's main responsibilities include assisting residents with daily living activities such as personal hygiene, dressing, mobility, and mealtime support. Beyond physical assistance, emotional well-being is equally important, offering companionship, listening, and promoting independence whenever possible. I also ensure medication is administered correctly, record observations accurately, and maintain a clean, safe environment. Collaboration with colleagues, healthcare professionals, and family members helps create a holistic care plan. In short, my job is to provide compassionate, person-centered care that enhances both comfort and dignity. 3. How do you handle challenging or aggressive behavior from residents? This question tests patience and de-escalation skills. I stay calm and professional. First, I assess the situation to understand what triggered the behavior: pain, frustration, confusion, or unmet needs. I use a gentle tone, maintain safe distance, and give the person space to express themselves without confrontation. Empathy helps more than authority. I reassure them and redirect their focus when possible. If necessary, I follow the organization's safety protocols and report the incident accurately. Consistency, patience, and understanding go a long way in restoring trust and stability. 4. How would you maintain a resident's dignity while assisting with personal care? Dignity means treating residents as individuals with full respect. When assisting with personal care, I always explain each step beforehand, close doors or curtains for privacy, and use towels or clothing to keep them covered as much as possible. I encourage independence. If someone can wash part of themselves, I let them. I avoid making assumptions, and I always address them politely. It's important to remember that these moments can make people feel vulnerable, so empathy and discretion are vital. 5. Can you describe a time when you went above and beyond for a resident? In one of my previous roles, a resident was anxious because she missed her favorite weekly outing. I coordinated with my supervisor and organized a small indoor version of the event with music and snacks she enjoyed. Her happiness lifted not only her spirits but others as well. It reminded me how little gestures can make big differences. Going beyond standard care means noticing emotional needs, not just physical ones, and creating moments that make residents feel truly cared for. 6. How do you handle confidentiality in your work? I strictly follow confidentiality policies because residents trust us with personal information. I never discuss private details with anyone not directly involved in their care. Sensitive documents are stored securely, and conversations happen in private areas only. If I ever need to share information, for example, about health or safety concerns, I do so only with authorized personnel. Respecting confidentiality builds trust and ensures residents feel safe and respected in the environment we create together. 7. What would you do if you noticed a colleague mistreating a resident? I would act immediately but responsibly. Resident safety comes first, so I'd ensure the person is safe, then report the incident following safeguarding procedures. I wouldn't confront the colleague aggressively but would document and escalate it to my supervisor or the safeguarding officer. It's never acceptable to ignore abuse or neglect. Protecting residents is part of my ethical and legal duty. I believe in transparency and accountability to maintain a culture of trust and compassion in the workplace. 8. How do you support residents with dementia or memory loss? Patience and consistency are essential. I approach residents calmly, use their name, and maintain eye contact to build connection. Instead of correcting confusion, I gently redirect or validate their feelings. I use memory aids, simple instructions, and familiar routines to reduce anxiety. Creating a calm environment with familiar objects also helps. I remind myself that behavior is communication, so I try to understand what they're feeling, not just what they're saying. Empathy and structure make dementia care effective. 9. Describe a time you worked effectively as part of a team. In my previous care home, teamwork was vital during busy morning routines. I communicated regularly with nurses and other carers, dividing tasks efficiently. Once, we faced short staffing, so I offered to handle additional residents temporarily, while others covered medication and meals. We kept each other updated through quick briefings, which reduced confusion and stress. That day proved how collaboration and respect make a shift smoother and residents better cared for. Strong teamwork ensures safety, morale, and consistency. 10. How do you manage stress in a demanding care environment? Care work can be emotional, so self-care and balance are key. I manage stress by staying organized, taking short breaks when possible, and talking to colleagues for support. I focus on one task at a time and remind myself why I'm here, to help others. After work, I unwind through exercise or quiet reflection. A positive attitude, communication, and humor help create a calm environment for both residents and staff. Managing stress ensures consistent, compassionate care. 11. How do you ensure accuracy in documentation and record keeping? I understand how crucial accurate records are for continuity of care. I record information promptly after tasks, double-check dates, times, and details, and use clear, factual language without assumptions. If I make a mistake, I correct it following proper procedure. I also respect confidentiality when handling files. Accurate documentation helps other team members understand residents' progress and supports legal compliance. I see record keeping not as paperwork but as part of professional responsibility and quality assurance. 12. What does person-centered care mean to you? To me, person-centered care means recognizing every resident as a unique individual with their own needs, preferences, and history. It's about involving them in decisions about their care and respecting their choices, even if they differ from mine. For example, allowing someone to choose what clothes to wear or when to eat can give them a sense of control. It also means adapting care plans as needs change. This approach creates dignity, trust, and stronger emotional connections. 13. How would you assist a resident who refuses to take medication? I'd start by calmly asking why they don't want it. Sometimes it's fear, confusion, or side effects. I'd explain the medication's purpose in simple terms, respecting their right to choose. If they still refuse, I'd never force them. Instead, I'd report the refusal to the nurse or supervisor and document it accurately. I might also offer reassurance or suggest a different time if appropriate. Patience and understanding can often resolve refusals without confrontation or distress. 14. How do you maintain professional boundaries with residents? I build warm, caring relationships without crossing professional lines. That means being friendly but not overly personal, avoiding sharing too much about my private life, and not accepting gifts that could cause misunderstandings. I maintain emotional empathy but remember I'm there in a professional capacity. Boundaries protect both the resident and me, ensuring respect, fairness, and consistency. Even when residents grow attached, I remain kind yet professional, focusing on their well-being, not emotional dependency. 15. What would you do if a resident falls and injures themselves? My first step would be to stay calm and ensure the resident's safety by not moving them unless necessary. I'd call for medical help immediately and comfort the person while assessing the situation. Once professionals arrive, I'd assist as directed. Afterward, I'd record the incident accurately, report it to my supervisor, and review safety measures to prevent recurrence. Following protocol, keeping communication clear, and showing empathy are key in such situations. Safety always comes first. 16. How do you support residents' emotional well-being? I support emotional well-being by actively listening and engaging in meaningful conversation. I take time to learn residents' interests, hobbies, and backgrounds so I can connect with them personally. Encouraging participation in social activities, celebrating birthdays, or simply sharing a laugh can brighten someone's day. When residents feel down, I offer empathy and patience rather than rushing them. Sometimes small gestures, a warm smile or cup of tea, make all the difference. Emotional care equals quality care. 17. What would you do if a resident refuses your help? I respect their autonomy first. If a resident refuses help, I'd step back, ask why, and reassure them that I'm there when they're ready. Sometimes people need control over their routine or just some space. I'd never insist unless there's a safety issue, in which case I'd calmly explain the risks. I'd document the refusal and inform the senior staff if it's recurring. Respecting choice builds trust and often leads to better cooperation later. 18. How do you adapt care for residents with different cultural or religious backgrounds? I always take time to understand each resident's cultural and religious preferences, from dietary restrictions to prayer times and social customs. I ask respectfully and include these needs in the care plan. If I'm unsure, I seek guidance from the resident, family, or supervisor. Showing cultural sensitivity creates comfort and inclusivity. For example, I've supported residents by preparing halal meals or ensuring privacy during prayer. Respecting diversity builds trust and demonstrates genuine compassion. 19. How would you handle end-of-life care? End-of-life care requires sensitivity, compassion, and respect. I focus on comfort, ensuring the person is free from pain, surrounded by dignity and emotional support. I communicate calmly, offer reassurance, and respect their spiritual or cultural wishes. I also support family members, listening and providing updates when appropriate. It's emotionally challenging, but I remind myself that my role is to make their final days peaceful and dignified. Every person deserves empathy and respect until the very end. 20. How do you handle feedback or criticism from supervisors? I see feedback as an opportunity to improve. If a supervisor points out something, I listen carefully without becoming defensive. I ask clarifying questions to understand exactly how I can do better and apply that advice in my next shift. I also appreciate recognition for what's going well. Constructive feedback helps me refine my approach and ensures residents receive even better care. Continuous learning is part of being a responsible, professional care worker. 21. What steps do you take to ensure health and safety in the workplace? I follow all health and safety policies, including infection control, proper lifting techniques, and correct use of personal protective equipment. I conduct quick checks to make sure rooms are tidy and hazards are minimized, like ensuring floors are dry and equipment is stored properly. I report any risks immediately. Training and awareness are ongoing, so I stay updated with safety guidelines. Maintaining a safe environment protects everyone, residents, staff, and visitors alike. 22. How do you communicate effectively with residents who have limited speech or hearing? I use simple, clear language supported by gestures, facial expressions, or written notes if needed. Patience is crucial. I never rush them. I maintain eye contact and observe body language for clues about how they feel. If sign language or communication devices are used, I make sure I'm familiar with them. Effective communication isn't only about speaking, it's about listening with empathy and adapting my approach so every resident feels understood and respected. 23. How do you deal with a resident's family members who are upset or demanding? I stay calm, listen carefully, and acknowledge their feelings. Families often act out of worry or love, so I show empathy and avoid defensiveness. I explain the situation factually, using a reassuring tone. If it's beyond my authority, I refer them to a supervisor or senior staff. The key is professionalism and understanding. When families see that I genuinely care and communicate transparently, tension usually eases and cooperation improves. 24. How do you stay motivated in such a demanding role? My motivation comes from knowing that what I do matters. Even small actions, helping someone eat comfortably or making them smile, remind me of my purpose. I also set personal goals, such as learning new care techniques or improving communication skills. Positive teamwork and seeing residents' progress inspire me. I remind myself daily that caring is not just work, it's meaningful service that changes lives, including my own. 25. Why should we hire you as a residential care worker? You should hire me because I combine compassion with responsibility. I bring practical experience in personal care, documentation, and teamwork, along with a genuine dedication to residents' well-being. I understand the importance of empathy, patience, and communication in creating a safe, happy environment. I'm reliable, eager to learn, and able to adapt to different needs and personalities. Most importantly, I treat every resident as I would want my own family to be treated, with dignity and kindness. And that wraps up our top 25 residential care worker interview questions and answers. Remember, the best interviews aren't just about memorizing responses. They're about showing who you truly are, caring, dependable, and passionate about making a difference. Practice these answers, adapt them to your experiences, and walk in with confidence. If you found this video helpful, give it a like, subscribe for more career tips, and share it with someone preparing for their next care interview.